When you talk about the presentation in women and it not necessarily presenting as typically, what is the typical kind of road to diagnosis and how might it differ between men and women?
Yeah. So the hallmark classic clinical feature that we see in axial spondylitis is what we call inflammatory back pain. And of course, back pain is incredibly common. And if you ask any primary care provider, it's probably a good proportion of their day is dealing with back pain. And most of it is not inflammatory. So, inflammatory back pain has some very key features to it. It typically starts in patients who are younger than 40. It typically presents with stiffness in the morning and pain in the morning that gets better with exercise and movement, which is really the opposite of what we see in mechanical back pain or back pain from a slipped disc or a strained muscle, which usually is okay when you wake up in the morning, but by the end of the day is very painful. And the other hallmark of inflammatory back pain is that it tends to get better with anti inflammatory type medications. So, that is a pretty universal feature of anyone with axial spondylitis. Having said that, in women, they may not have the more typical presentation. It may not sound exactly like how I described. And very commonly in women and in men, but more so in women, they get what's called a central sensitization of pain. And what that is its involvement of the nervous system. So in that case, we're not just dealing with inflammatory type back pain, but when you have central sensitization of pain, what that implies is that the nerves that sense pain have been sensing pain for so long that they've been upregulated and they are now firing on their own, meaning that the nervous system has laid down new tracks for pain.
Mm.
And so that can look like pain in the cervical spine or pain elsewhere or pain everywhere, and not just the inflammatory back pain. And when that is present, that can really be the forefront of what the patient is talking about, which can delay diagnosis. So it's very important to remember, particularly with women, when you're considering this diagnosis, that they may not look like a textbook because the nervous system is more involved and that muddies the presentation.